Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I'm Councilmember Priscilla Tyson, President Pro Tem for Columbus City Council and Chair of those committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and Workforce Development. The goal of these hearings is to promote transparency and provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. There will be on occasion on which a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight, we will hear information on legislation in Health and Human Services and the Finance Committees. We have several presenters, including from the Auditor's Office, Deputy Auditor Bob McDaniel, from the Department of Finance and Management, the Director Joe Lombardi, Department of Development, Deputy Director of Community Development, Hannah Jones, and Columbus Public Health, Chief Nursing Officer and Assistant Health Commissioner, Nancy Bechtel. I will begin with legislation in the Finance Committee by asking Deputy Auditor Robert McDaniel to present. Good evening.
Good evening, President Pro Tem Tyson. The Auditor's Office has one ordinance to present tonight. Ordinance number 2476-2016 is for the city's employee bonding insurance. This is done once every 3 years, and this bonding period is going to commence January of 2017 through December of 2019. The Auditor's Office advertised this in the City Bulletin for 3 weeks, and the Auditor's Office mailed out solicitations to 18 prospective bidders. Only one response was received. This ordinance will allow the city auditor to contract with Huntington Insurance for the bonding of various city employees, elected and appointed officials, and members of the various city boards and commissions. This will authorize the expenditure of $137,409 from the general fund, of which was budgeted. If you have any further questions, more than glad to answer.
Thank you. And it will be for the bonding of, let me see, it looks like the city treasurer, the deputy treasurer, police through the rank of sergeant, and other city employees, and again, the elected officials, including all officially appointed members of city boards and commissions. Okay, forgery and alteration, money and securities on premises, money and securities on the premises, money orders and counterfeit money, computer fraud, and social engineering, AKA fraudulently induced transfers.
Yes.
Thank you. Okay, and for $137,000. Thank you very much.
You're welcome. Thank you.
Thank you. All right, our next presenter will be from the Finance Department, Director Joe Lombardi. Good evening.
Good evening, President Pro Tem Tyson. The Finance Department has, I believe, 12 ordinances for the 17th. The first ordinance is Ordinance 2295-2016, and this is the authorized the Finance and Management Director to modify all contracts and purchase orders held with Ashland Inc., DBA Valvoline Instant Oil Change. This is a name change from Ashland Inc. The FID number has changed. It's actually the same name, I'm sorry, but it's a federal ID number change. So this ordinance will just allow us to change all those contracts that we have with them throughout the city with the new federal ID number.
Thank you. And most of this oil is used for our police cruisers, is that correct?
Yes, in our fleet management division.
All right, thank you very much.
The next is 2305-2016. This to authorize the Finance and Management Director to enter into one universal term contract for the option to purchase semi-commercial washers and dryers with HM Company. This is an expenditure of $1 to establish that contract. These Commercial grade washers and dryers are to be used in our Columbus Fire stations to do both linen and laundry of their turnout gear. So we are going to set up a contract so that we can purchase those for some of the firehouses that are in need for upgrades in their washers and dryers. I think the total estimate from the fire department is $40,000. We will come back later with an ordinance to fund for those purchases. This is just to set up the contract so they can use it.
Thank you. I think the importance of having these units in our stations is because the research has indicated that the rate of cancer among firefighters decreases when there's installation of on-site laundry facilities.
Yes.
And so we want to try our best to make sure that our firefighters stay healthy.
That's correct.
All right. Thank you so very much.
Welcome. Next ordinance is 2308-2016. This is to authorize the Finance and Management Director to enter into a contract for the option to purchase whole tree wood chips with Edwards Land Clearing, Inc., and authorize the expenditure of $1 to establish the contract. This contract is for wood chips that are used as a bulking agent in our Comtil product through our Division of Sewers and Drains out of our Department of Public Utilities. Comtil is very similar to mulch or to a soil additive. It is made at the location at our compost facility, and these wood chips are part of the process to bulk it so that it can be then resold to commercial companies and private citizens as ourselves. We can also buy it. It works great. I've used it, so it's a real good product. The total estimated annual expenditure is $160,000, and that is strictly out of the Division of Sewers and Drains.
Thank you, Director. I had the opportunity to visit a number of our community gardens, and one of the gardens that I visited, they use Comtil to grow their product, and they also, this is an experiment, and they didn't use Comtil, and they planted at the exact same time, water, did everything the same, but the Comtil vegetables were, I should say, there was a major difference in the produce from that garden where the Comtil was.
Yes, it makes a difference.
It does make a difference. So thank you very much, and the expenditure is $160,000, and certainly glad that we as residents can also purchase the Comtil.
Yes.
Thank you.
Yes, ma'am. The next ordinance is 2452-2016, and this is to authorize the Finance and Management Director to enter into a contract for the option to purchase Cisco Network Engineering Services with Network Dynamics, Inc., to authorize the expenditure of $1 to establish that contract. This contract is primarily for our Division of Technology. It is to allow us to use network engineers to help our staff on some of the projects that we have throughout the city for technology needs. So this contract allows us to use some of the Cisco engineering personnel to assist our staff as well in those projects. The estimated cost annually is $500,000 on that contract.
Thank you, Director, and certainly understand why we need these engineering services. Just the one question I'm going to ask for our viewing and listening audience. I know that there were 814 solicitations and only 3 bids came in. And could you share why that happens?
Yes. Many times, especially with our technology bids, there are a lot of companies that are certified or under our commodity code for technology. That is not unusual to see that many bids being solicited, but because of the service, it will then pare down that field to a few companies that provide network engineers to help us with that. So many of those companies who have registered in those commodity codes aren't necessarily companies that would do services as opposed to sell technology. So that's why you see such a large number for solicitation and littler numbers for actual bidding on it.
All right, thank you.
The next ordinance is 2306-2016. This is to authorize the Finance and Management Director to enter into a contract for the option to purchase 8 cubic yard waste containers with Farmers Refuse and Trucking, Inc., and to authorize the expenditure of $1 to establish that contract. These are 8 cubic yard waste containers that are used for our trash collection, these will be used mostly by our refuse department out of public service, and these are the green containers that we all use for putting our waste in.
Thank you.
And I think the annual expenditure, ma'am, on that is $35,000.
Correct. Thank you.
Next ordinance is 2486-2016, and this is to authorize the Finance and Management Director to enter into a contract for the option to purchase Penn Valley pumps and pump parts from the Henry P. Thompson Company, to authorize the expenditure of $1 to establish that contract. This contract is to purchase Penn Valley pumps and pump parts that are used primarily at our Public Utilities Division of Sewers and Drains. These pumps and their parts are used throughout the wastewater treatment process, and this will set up a UTC so that our Division of Sewers and Drains can buy not only the pumps, but also the parts for those pumps. And the estimated annual expenditure for this contract is $30,000.
Right. Thank you very much.
The next ordinance is 2482-2016. This to authorize and direct the Finance and Management Director to issue purchase orders up to $100,000 for AT&T telecommunication services with AT&T for various city agencies from an existing cooperative State of Ohio term contract established for such purposes by the State of Ohio Department of Administrative Services. This contract is a cooperative contract. Ordinance 582-1987 authorized city agencies to use State of Ohio Department of Administrative Services contracts when deemed most cost effective. This ordinance is allowing our divisions to get purchase orders up to $100,000 before coming to City Council for approval of any more funds to buy AT&T services for various agencies. I did not see on here what our annual expenditures, because we are limiting them up to $100,000. So it depends on how many agencies use and how much money they need for their AT&T communication services.
Of course, if they have to go over $100,000, it will come to this body.
That is correct. If they go over to $100,000, they do have to come to City Council to get approval for that.
All right. Thank you.
Next ordinance is 2520-2016 to authorize the Finance and Management Director to enter into one UTC contract for the option to purchase aluminum sheeting material and sign blanks with Gary S. McMahon, DBA Allmac Signs, and to authorize the expenditure of $1 to establish that contract. This contract will allow our Public Service Department to purchase aluminum sheeting material and sign blanks for use for street signs and traffic signs. The estimated expenditure for this contract is $125,000.
Thank you.
The next ordinance is ordinance 2521-2016 to authorize the Finance and Management Director to enter into 2 UTC contracts for the option to purchase traffic vehicular signal heads with Pathmaster, Inc. and Baldwin and Sowers, Inc., and to authorize the expenditure of $2 to establish those contracts. This contract is primarily used by our Public Service Department Traffic Engineering Section, and these are our traffic signal heads and parts and lights and all those things for our traffic signals. The 2 contracts, these are being awarded to the low bidders on each one of those items. So we did split this bid out to 2 different companies on this one.
Thank you, Director. And Director, one of the virtues of the universal term contract is that different departments buying a lot of the same things don't need to keep coming back for separate approvals. All the departments need uniforms, toilet paper, office supplies, etc. But again, this UTC is probably only going to be used by one division with public service. So are there reasons to establish UTCs outside the fact that they are useful to multiple departments?
Yes, it does make it. Are you asking if it's to use a UTC if there's only one department that is affected by that UTC?
That's correct. And so why would that still be useful?
Yes, so that's useful because from an administrative and an operational standpoint, the division is able to order on an as-needed basis, so that does lower your inventory as well. But also because of we buy in such quantity that you get a better pricing structure from the companies. We do allow on some of those for an escalation clause after 1 year. Sometimes it's 6 months, depending on the commodity. But I believe it's very important to have a UTC because those divisions then can order as they need it, as opposed to ordering all at one time and then having it on a shelf, and inventory, you know, obviously will cost them money to have that on the inventory.
And so they will be buying the traffic signal equipment as needed?
As needed, yes.
Thank you.
The next ordinance is 2528, 2016, to authorize and direct the Finance and Management Director to issue purchase orders up to $100,000 for telecommunication services with Time Warner Cable, Inc. for various city agencies from an existing cooperative State of Ohio term contract established for such purpose by the State of Ohio and Department of Administrative Services. As the other cooperative ordinance we talked about earlier, this one is for our cable, Time Warner Cable, and also can be used if needed to extend our broadband should we need that for the body-worn cameras that will be coming. So this will also help us if we need to extend the broadband capabilities of the city. And again, the divisions that are allowed to spend up to $100,000, anything above that will need to come to before this body for approval.
Thank you very much.
Next ordinance is ordinance 2529, 2016. This is to authorize the Finance and Management Director to enter into one UTC contract for the option to purchase prescription safety glasses with Express Lens Lab, Inc., and to authorize the expenditure of $1 to establish that contract. This is a citywide contract for prescription safety glasses for our workers who need and are provided safety glasses for their job, and if they have a prescription. So these are actually safety glasses that are prescribed or prescription, just as I'm wearing this evening, but these aren't safety glasses. Total estimated costs annually is $25,000 for that contract.
Thank you. And again, we want to make sure that our employees that are working for the City of Columbus, that we want to keep them safe so they can continue to provide services to our residents.
Yes.
And so thank you so much.
Welcome. And the final ordinance is 2546, 2016. And this is to authorize or to amend the 2016 capital improvement budget to authorize the city auditor to transfer various funds within the construction management capital improvement fund, to authorize the finance management director to expend $145,000 or so much thereof as may be necessary to reimburse the general fund for construction and building renovation expenses incurred by the Office of Construction Management, and to authorize the expenditure from various capital projects. We submitted a ordinance 1941, 2016, which City Council passed on September 12th, authorizing $555,000 for this same purpose. Our construction management department bills back for their time on projects, construction projects. So this ordinance is asking for another, basically it's a correction of $145,000, and what I mean by a correction is that we bill back to the capital fund and they'll reimburse the general fund for the time that our folks spend on those projects. The earlier ordinance that we gave was an estimate of timesheets that were done up through September, I believe it was, or at least near to September. And we waited for the bond proceeds from the bond sale that we had in June to be able to make that reimbursement. And this is just another reimbursement, and this should be the last one of the year. This should be the final one we'll need.
And I, of course, asked a couple of questions about that. So now that means, so $700,000 would be the total number?
That's the total number we're asking to move. We don't think we'll need all $700,000 to reimburse our staff for that time.
Okay, and so obviously we have more projects, because I know the reimbursement in 14 was $614,000, and in 15 it was $503,000, and so now we're looking at this estimate being approximately, right, $700,000.
Mm-hmm.
Is that right?
Yes.
Okay. And so if you're not, and then could you tell the viewing and listening audience, if we don't use all $700,000, what happens to those dollars that we're authorizing here?
Those dollars that are in the general fund will carry over as part of a savings, as part of our carryover on the savings. We do our best to try to estimate what our time's going to be on those projects. Sometimes one project may not have as much time associated to it as another project, so we do work with the city auditor to do this each year to make what we call an expenditure correction back to the general fund for their time that they spent on those capital projects.
All right, thank you for your explanation.
You're welcome. We have one ordinance that will be coming on the 17th that is in process now. There's no ordinance number associated with it at this time. We're still working on the draft and details, but I have a little bit of information that I can share with you this evening. The city owns a parcel at the corner of Rich and South 3rd Street, about 1.29 acres, that we lease to Capital South Community Urban Redevelopment. It is the Columbus Commons area. Columbus South has identified a developer called 225 Commons LLC that is interested in doing a development of that parcel of land. Our ordinance, which again is still being worked out, the details of that ordinance are still being drafted, would propose to release Capital South of that lease and convey that to 225 Commons Group so that they can develop that. I think it's 1.29 acres of land. The proceeds of that will go into the general fund of the city.
Are we still in negotiation with the person that's purchasing this?
Yeah, so we are still doing that, but we knew this was probably going to be on council's agenda for the 17th, and I can get to your office more detail once I have that. I just talked with Ann Kelly, our administrator of real estate, before this evening's hearing, and this is what she provided me, and that we will have more details for you at a later date, but before the 17th.
That would be great. Of course, you know I'm going to ask you what the assessed value of the land is,
Yes.
and how much we are selling this land for.
Yep. And so she's working on that.
Okay.
So we'll have those answers for you.
All right. Thank you very much,
Thank
Director.
you. And I think that is it for the finance department.
Thank you very much. All right. All right. Our next presenter will be Ms. Hannah Jones from the Department of Development. Ms. Jones, the floor is yours.
Good evening, President Pro Tem Tyson. For your consideration this evening, we have one ordinance, and while I describe it, I will invite Bill Owens, who serves as the Executive Director for the Clintonville Beachwald Community Resources Center, to come up to the podium. This evening, we have Ordinance 2534-2016 for your consideration. This ordinance allocates $20,000 to benefit the Clintonville Beachwald Community Resources Center, and specifically the supportive services that they provide to our senior community. And I will let Bill give you some details on how the money will be utilized.
Thank you. Good evening, Bill.
Good evening. Thank you very much, President Pro Tem Tyson, for this opportunity to talk with you about the Clintonville Beachwald Community Resources Center. We're one of 6 settlement houses here in Columbus. Different from any other senior social service agency, we settlement houses, instead of looking at a particular social problem or special population, we look at geographic areas and see what opportunities and issues there are there to address. For us at the CRC, we have a primary focus being the Clintonville Beachwald neighborhood, but we also take on the work of some of our neighboring communities, such as 43224 in the North Linden area, and 43235, which is just on the other side of the Olentangy River from Clintonville, and we serve some of our neighbors there. So since 1971, the CRC has been providing services to the Clintonville Beachwald neighborhood and to the community at large. What funding we're looking to get help with this evening is with our Senior Supportive Services Program. For all of us to understand that if we're fortunate enough, we'll all become older adults at some time. And really the only difference between us younger folks and us older folks is our health and our ability to get around and to do things for ourselves. So we're able to provide services to make sure that everybody in our community is able to meet their needs as they grow older and to age in place. That is, to stay in their own homes, living as safely and independently as possible. So I've been at the CRC for 21 years, and we've had these programs long before I came along, seeing to it that our elder neighbors are able to always meet their needs. In the early days, it was known as friendly visiting, and it really was a matter of checking in on our older citizens and making sure they're okay and getting them a ride to the doctor and some pretty simple things. As time has gone on, it is much more complex to deal with things like Medicare and to make sure that people have their bills paid and that they meet all their needs within their households. It's really become more difficult. So the funding we're looking for this evening would help us to provide those supportive services to seniors, to make sure that they have adequate food, that they're able to get to a food pantry if they need to, that they're able to apply for any benefits that they might need to keep their household whole, to keep their heat on in the wintertime, to keep their cooling in the summertime, and to be able to have fresh produce from the local farmers market, as well as being able to access whatever health care they might need. So really this is a program to make sure that folks have all the things they need, but especially those of us as we get older that makes it harder to meet those needs on our own.
Well, Bill, first of all, thank you for coming down, and certainly appreciate you spending 24 years of your life serving this particular community, and more particularly our seniors. I know this legislation is the funding out of emergency human services dollars, as well as also dollars that my council colleague, Councilmember Michael Stenziano, has also put dollars into this for one of the funds that we have here at council. So just appreciate the work that you're doing in the community, and certainly I know we're focused on an age-friendly, being an age-friendly community, and Councilman Stenziano, I know, is working a lot on that, and each of us are supporting him in that effort. But just really appreciate the work that, again, that you're doing. And again, if we're all fortunate enough to become, as we are, I'm already a senior, but to be able to grow and in terms of continuing to live my life as a senior, I just would want to also have those services available to me. So I thank you for the work that you're doing, and as people are living much longer, they need additional assistance, and so we want to be able to make sure that we're helping all of our seniors in our community. So thank you. Looking forward to having this presented at our council meeting on the 17th? On the 17th. So excellent. Thank you so much.
Well, thank you very much.
All right, have a great day.
You too.
All right, Ms. Jones, that completes your legislation. And now I'm going to move to our final speaker, and that is Chief Nursing Officer and Assistant Health Commissioner Nancy Bechtel, who provided information on legislation from Columbus Public Health. Good evening.
Good evening, Councilwoman Pro Tem Tyson. All right, we have 5 pieces of legislation that we are putting forward tonight. The first one is ordinance number 2408-2016, and this is to accept and appropriate $125,000 for the Safe Communities Grant. We've been awarded this grant from the U.S. Department of Transportation through the Ohio Department of Public Safety. This ordinance is needed to accept and appropriate the $125,000 to fund the Safe Communities Grant Program for the period October 1st, 2016 through September 30th, 2017. The Safe Community Programs provides traffic safety services through the dissemination of safety awareness and education throughout Columbus and Franklin County.
Nancy, can you tell me, for the $125,000, do you know what the money will be spent on?
$121,099 and some change of it supports staff salaries and benefits. And then about $3,900 of it is for materials and supplies that we need to manage the grant.
Can you talk a little bit about the grant? Because I know it's more human resources intensive, so can you just kind of share what happens with this program?
Sure. So the Franklin County Safe Communities Grant is a traffic safety program that we do through the health department, and it focuses on a multiple of traffic safety issues. We do seatbelt use, impaired driving, distracted driving, motorcycle safety, teen driving, and pedestrian safety. And it's a combination of educational programs, services, and media events that we do throughout the year.
Thank you. Do you know if someone wants to get involved or have Public Health come out and present on any of the topics you just mentioned, how would they do that?
Yes, so of course you can always call 311 to get connected to our services, but if you want the direct phone number, you can call 614-645-6138.
And finally, do you know how many sessions or forums you held either in 2015 and the first half of 16?
We did 67 community events, I believe, and we reached over 51,000 residents in our, including in our minority communities with our traffic safety messaging and programs. With the media events that we do specifically for Click It or Ticket, which is, what we advocate for seatbelt use, and the Drive Sober, Get Pulled Over campaigns, for Motorcycle Awareness Month, for Teens Safe Driving Month, and the Pedestrian Safety Initiatives, and the Safe Drinking Initiative we do for St. Patrick's Day, we reached over 1.2 million with the media events.
Thank you very much. Good use of those dollars. Thank you.
The second piece of legislation is ordinance number 2423-2016, and this is to accept and appropriate the Franklin County Healthier Buckeye Initiative. So we've been awarded this grant from the United Way of Central Ohio, working with the Educational Service Center of Central Ohio on behalf of Franklin County Family and Children First Council and the Healthier Buckeye Council, as a shared implementation of the Franklin County Healthier Buckeye Initiative. This ordinance is needed to accept and appropriate $89,008 in grant monies to fund the healthy food access, education, and resources in the priority neighborhood of Franklinton for the period of July 29th, 2016 through June 30th, 2017. We will conduct district-wide BMI screenings with Columbus City Schools Wellness Initiative during the school year, and in 2014 and 2015, that showed that 30% of pre-K students are overweight or obese. Childhood obesity is especially urgent in the Franklinton area, where over 60% of residents are overweight or obese. So this program provides education for providers of education in the schools and daycare centers to do activities and healthier eating options for children who are at risk for being overweight or obese.
So the program is really focused on the children and providing them with information?
So the information is provided to the facilitators at the school or the daycares, and then they implement the initiatives down with the children population in their facilities.
With hopes that they would be able, based upon those activities, that hopefully it would reduce their the overweight or obesity in our young people. Is that correct?
Yes, and we hope to impact over 400 children with this grant.
Thank you very much.
And I guess I would say that if you want information about the Healthy Children, Healthy Weights program, the number for that is 614-645-7520. The third legislation that we bring to you tonight is ordinance number 2470-2016 to accept and appropriate a grant from the Ohio Department of Health for the Ohio Infant Mortality Initiative, Ohio Infant Mortality Reduction Initiative grant. So we've been awarded this grant from the U.S. Department of Health and Human Services through the Ohio Department of Health. We need this to accept $258,000 in grant money from the OMRI, or Ohio Infant Mortality Reduction Initiative grant program, for the period October 1st, 2016 through September 30th, 2017. The Ohio Infant Mortality Reduction Initiative program is a culturally specific home visitation program that provides in-home, family-centered service coordination and education services to high-risk, low-income African-American pregnant women and their infants to age 1 who reside in 14 specific Columbus zip codes, which include 43203, 04, 05, 06, 07, 11, 15, 19, 22, 23, 24, 27, 29, and 32.
So is this the first time we have received this grant, or have we had this grant in the past?
Oh, we've had this grant for many years, and the Ohio Department of Health seems to be pleased with our work.
So talk to me about the successes of the work.
So this grant serves about 130 women a year. It's targeted to our communities that have the highest rates of infant mortality disparity. You've heard us talk here before about how, as a county, we have a higher infant mortality rate than a national average, and our African American infant mortality rate is 2.5 times the white infant mortality rate. So this grant allows us to specifically provide more intensive services in these zip codes to African American pregnant women and their infants who may need them, to try and impact the disparity. So we've served from July 1st to 2015 to June 30th, 2016, 199 families on this grant. So we have overachieved the capacity even for what they fund us for. So I think that's one of the reasons that they're pleased with our work. Successes of the OMRI program include an 8/6 low birth weight rate among children born in the program, and so that is lower than the rate of general low birth weight in the African American population in the county. So women in
I'm
this,
sorry, can you share that again, that
Sure.
number again?
So the low birth weight rate among children born in this program is 8.6%. And so in the county, it's much higher. And the infant mortality rate of all children born in the program was 1.69%. And you know, in the county, we're much higher than that. So the program has success.
And again, it's an in-home, family-centered program.
Yes, we go into the homes, we provide the pregnant mom and the new mom up to age 1 with a lot of services to help her have a healthy pregnancy, deliver a healthy baby, and then get herself healthy and keep that baby thriving through 1 year of age.
And again, so if someone is watching, will be watching this hearing, will they could they get involved with this program?
So they can call us at the health department, and the number for that is 614-724-BABY or 614-724-2229.
Thank you.
You're welcome. The fourth piece of legislation that we would bring here tonight is ordinance number 2495-2016, and this is to authorize a revenue contract with the Ohio Child Care Resource and Referral Association. So Columbus Public Health proposes to provide updated curriculum and training on the Healthy Children, Healthy Weights Child Care Train the Trainer program to the Ohio Child Care Resource and Referral Association, or OCRA. It's necessary to enter into a revenue contract to provide the Healthy Children, Healthy Weight training. Under this contract, OCRA will reimburse the Board of Health for the provision of the Healthy Children, Healthy Weights training in an amount not to exceed $7,168.44 for the period of July 1st, 2016 through June 30th, 2017. And we were invited to provide this training. We have done it in the past, again, because they're pleased with the quality of our program.
And do you know how many training sessions that you typically run during this past year?
I believe we do 2 training sessions throughout the year, and we train 24 participants per session. And it's like a 15-hour training, so it's in depth.
And what would you say at the very end that the trainees walk away with? What skill sets?
They're able to replicate the Healthy Children, Healthy Weights program at other schools and daycare centers in their districts.
Thank you very much, Nancy.
And then the last piece of ordinance that we bring to you tonight is number 2519-2016, to accept a grant from the Ohio Department of Health for the Maternal and Child Health Program. So we've been awarded a grant from the U.S. Department of Health and Human Services through the Ohio Department of Health. This ordinance is needed to accept and appropriate $405,184.09 in grant money to fund the Maternal and Child Health Grant Program for the period October 1st, 2016 through September 30th, 2017. This project will address high smoking rates, especially among pregnant women, high rates of overweight children in Franklin County, high infant mortality rates, with significant racial disparities throughout the Columbus, Ohio Equity Institute project, and the high incidence of sleep-related deaths. The funds will also support Columbus Public Health's fetal infant mortality review program and a transportation needs assessment focusing on the accessibility of Franklin County WIC clinics to WIC clients.
I'm very excited to get this grant. I'm happy that it's also going to support the fetal infant mortality review program. I've had the opportunity to hear the results of that program, and certainly happy that we're going to have some dollars to support that. And I know just yesterday, we passed significant legislation in regards to the WIC clinics, and certainly want to make sure that transportation, if transportation is an issue for people getting to those clinics, I'm happy that you're going to do an assessment to see if that is a challenge, and then what needs to be done if it is a challenge, because we want people to be able to get to those services, since they have services for up to age 5, and we want to make sure that our women and children are able to get the services that are at our WIC clinics. Of course, I'm glad you're going to address the high smoking rates. It's something that's very important to me, and ensuring that we try to reduce the high smoking rates, especially amongst our pregnant women. So happy that we have received this grant, and look forward to the needs that will be addressed by these dollars. Do you have any idea, Nancy, how many people will be served by this grant?
Oh, in total, I don't. I know that the tobacco portion of this grant is going to serve an additional 55 clients. We serve between 100 and 150 now. The child care centers that will benefit from the healthy weight portion, I don't I don't have the number there, but I can certainly get you that. The Safe Sleep Ambassador trainings and the Safe Sleep work, so far in 2016, we've distributed over 700 cribs to families who need them. So if we keep going at that same level, it'll be in the hundreds. And I know we've done 14 Safe Sleep Ambassador trainings and reached 355 residents year to date. So again, if we keep going because of this grant, we'll be able to reach hundreds more residents with Safe Sleep training. Hoping up to maybe 700 more families throughout the year with these grant dollars. With our FEMA work, we contact every family that we know about or that we get data from death certificates who've lost an infant either before they're born or in the first year of life. And so far this year, I know that we've reviewed about 50 cases, 48, I think, and so hopefully that number will continue to grow. We certainly want to be here to support our residents who may be losing infants.
Thank you very much. This is, I'm excited to be getting this $405,000 to meet the needs that you just discussed. So thank you. Thank you for your work and being able to get this grant because of the fine work that you're doing in the Department of Health. I hope this evening's hearing has provided insight into the programs and the community initiatives from Columbus Public Health and the Department of Development, as well as the Finance Department, the legislation that is necessary to support our ongoing city operations. As residents, these hearings are an opportunity for you to become more engaged in issues that we present. Before I conclude tonight's hearing, I want to thank from the Auditor's Office, Deputy Auditor Bob McDaniel, from the Department of Finance and Management, Director Joe Lombardi, from the Department of Development, Deputy Director Hannah Jones. I see Hannah Reed is also in chambers this evening. Columbus Public Health Chief Nursing Officer and Assistant Health Commissioner Nancy Bechtel. I always want to thank my fellow council members who really work hard each and every day to serve our community. I want to thank our Legislative Research Office, especially Michael Kessler, who leads the Legislative Research Office, Andrew Dwyer, who staffs Health and Human Services, as well as Aaron Beck, Matt Erickson, who staffs the Finance Committee, and also my staff, Nicole Harper and Carl Williams, the hardworking team at CTV who make these hearings possible, and finally, I always want to thank the residents of Columbus who make our city the best place to live, work, and to raise a family. And I would say this hearing is adjourned. Have a great evening, everyone.